Hello everyone, this is Dr. Priya here and welcome to another video with New Roots Hair Clinic. Today we are here to discuss if PRP is necessary after hair transplantation. Nowadays PRP is recommended after transplantation. Before and after surgeries, when it comes to PRP, we have n number of questions in our mind. Like why PRP is recommended, how many sessions of PRP should we take, or what are the benefits of PRP. So let's discuss all these queries in this video. Before going into the video, let's understand what exactly PRP is. PRP stands for platelet-rich plasma, and it is basically a concentrated plasma which is obtained from centrifuging blood which is freshly withdrawn from a patient. And it contains leukocytes, growth factors, platelets and cytokines. And it has been observed that it really helps in hair loss prevention, wound healing and soft tissue healing. Let's move on to the first part of this video, which is why PRP is recommended after hair transplantation. Well, in order to obtain plasma, patient's own blood is used here. And during the surgery, there are few surgical damages that are caused while making slits or while during the implantation. So all the growth factors which is present in plasma helps in faster recovery of these soft tissue wounds or the soft tissue injuries that are caused during surgery. And not only that, like I said, it has growth factors in it, so it also nourishes the follicles. Let's talk about what are the advantages of PRP after hair transplantation. During harvesting of the follicles from the donor area of the scalp and moving it to the recipient area, chances are there that these follicles might get damaged due to certain conditions like dehydration. If the follicles are not well kept in the hydrating fluid, it can be dehydrated. Second point is starvation of oxygen and nutrients. When the follicles are cut off from their blood supply, this might happen. Temperature and acid-base balance is very important. Fourth point is revascularization injuries can happen while transferring the follicles from the donor area to the recipient area. So here PRP plays a very important role. It helps or initiate process of hair production with the help of growth factors which is present in it by initiating the transition from the resting phase to active phase. Now let's discuss PRP during hair transplantation. Many surgeons use PRP treatment while during the hair transplant surgeries in order to store and maintain the viability of graft. It also can be injected in the wounds for faster healing. It also minimizes the scarring and promotes maximum growth. Now let's discuss when PRP should be taken. Well, in order for the PRP therapy to work, it is extremely important that it is done at the right time. PRP treatment can be taken 10 days after the surgery without any problem. Further sessions can be scheduled at 1 month, 3 months or 6 months later. A total of 4 sessions is usually sufficient. Let's move on to the next part of this video, which is what if someone is unavailable to take PRP therapies after hair transplantation. If anyone is unavailable to take PRP therapies for some reason, then in those cases, it is not necessary that they'll not get the results after hair transplantation. It's just they'll lose the benefit of PRP therapy. PRP stands out as an innovative and advanced treatment. With this, you can increase the success of hair transplantation. Moreover, not only the transplanted hair and grafts, your existing hair will also be affected positively. Your weak hair will get stronger and fuller. I hope I was able to answer all your questions in regards with PRP. I will see you again with a new video. Till then, please take care.